So most patients requesting rhinoplasty, they've been thinking about it for a long time. In the case of women, they often have a dorsal hump. They don't like their profile. They're usually okay on their frontal picture, but they don't like how they look on the side. And they want their nose to look more attractive, more in keeping with their face and balanced, but they don't want to look like somebody else, and they definitely don't want to look operated on. Now, there are a couple of different ways to do a rhinoplasty. One of them involves making an incision across the columella, flipping the skin back, exposing the framework of the nose. That's called an open rhinoplasty. The other way is closed, where the incisions are made on the inside. Sometimes people call that a scarless rhinoplasty, but it's actually been around a long time. That's the approach that I use when I do most of my rhinoplasties, because of course you've got the advantage of no visible scar. I emphasize to my patients that it's better not to overdo a nose. If anything, we'd rather underdo than overdo. And when I do the rhinoplasty, we're typically taking down the extra bone in the hump, and we're also refining the cartilages in the tip so that the nose is balanced. It looks good from top to bottom, and it looks natural. Now, if a nose looks natural after the surgery, a lot of people might not even know that the patient has had a rhinoplasty. Amazingly, this patient had friends, she did it during her summer off at school. A lot of her friends didn't even know that she'd had a rhinoplasty. So it's a very gratifying procedure. It's a difficult operation. Sometimes we do revisions to take care of little asymmetries or bumps afterwards, but patients really like it. It's something they thought about for a long time, and it gets rid of that self-consciousness that they've had about their nose for years.